Hello, Mr. Jones. My name is Brent Bradeen. I'm a student nurse at the University of South Alabama, and I'm here to perform a normal saline wet to dry dressing change to hip every 4 hours. I'm going to follow hospital policy to provide privacy during your assessment and procedure. And I'm also, before I can start with the assessment and gather my materials, I have to get some information for you. So I'm going to use at least 2 patient identifiers to make sure I'm dealing with the right patient. So, Jaguar Jones, date of birth is August 25th, 1963, that coincides. Room 2040, and his only allergy on the chart and on his wrist is penicillin. Are you allergic to anything else, Mr. Jones? Alright, we're in good shape, we can move forward. Now I'm going to wash my hands with regular soap, plain soap and water. Remove my trash can. Place antiseptic hand rub on my hands. And I'm going to raise the bed to a working, comfortable height. And I'm going to lower the side rail. And then after that, I'm going to check on my patient to make sure he or she is comfortable. In this case, Mr. Jones is the he. Then I'm going to don my non-sterile but clean gloves. After donning my gloves, I'm going to put on my goggles. And when I move to the wound, I'm going to make sure to start from the side furthest from me, start on each edge, and pull towards the wound. And repeat the process on the other side, because if you pull off in one direction, you risk pulling off part of the patient's skin. No one wants to do that. So with your left hand, my non-dominant hand in this case, I'm going to swiftly pull it, but gently off. Have the inside of the secondary dressing facing up towards the sky and away from the patient. I'm going to remove the primary dressing. And while I remove the primary dressing, I'm going to be assessing the primary dressing using the TACO acronym. I'm going to address the type of drainage, the amount, the color, consistency, and odor, all while maintaining privacy. And when I'm done assessing the drainage on the dressing, I'm going to move to the wound itself. And when I assess the wound, I'm going to be looking at its size, whether it's granulation, necrotic, slough. I'm going to talk about the odor a little bit. And after I do all of that, then I palpate the peri-wound area, being careful not to touch the wound itself. And after this, and during this process, I'm really going to be thinking about whether I see redness, edema, which is swelling, and any reported tenderness from the patients. All 3 of these individually are cardinal signs of infection. And after I do this, I'm going to simply take my old dressing, bundle it up in my hand, over the trash can, remove my glove, and then place both of those in my other glove, and do the same thing, and throw them away. And then now that I'm here with clean gloves, I can begin to prepare my sterile field. So I'm going to open my dressing tray. I can only touch the perimeter of this to maintain sterility. I'm going to tuck this under it. And now that I'm here, I have to prepare my sterile wound field. I'm going to grab this in one swift motion. I'm going to grab the adjacent corner. I'm going to fluff it out. And I can manipulate this because there's a 1-inch sterile border and none is hanging off the table. Get a flat surface, grab the perimeter carefully, and the lid, and I'm going to swiftly empty the contents of this container on the middle of the tray and back. Now that I'm here, it is time to get the saline solution in the tray itself. With this, if you want to come over here, I'm going to confirm the label is 0.9% normal saline, and this is within the expiration date, so we're good to go. Now with the label, you want to palm the label because you want to protect the integrity of the labels for future nurses using this. And when you open the cap, you want to keep the cap up. And you want to slowly pour the saline solution in your container to avoid contamination and any splashes on your sterile field, which will break sterility. Once you're here, you replace this And once you replace it, everything is set up for sterility. Everything is sterile besides you, so you have to glove up. Move this out of the way. I'll wash my hands. I'm going to open the sterile door a little bit. And before I put gloves on, I'm going to ask Mr. Jones if he has a latex allergy. And since he doesn't, I'm good to go. I'm going to start with my dominant hand. I'm going to grab the cuff. I'm going to slide my hand in there. And then hopefully, in one swift motion, the glove should be not far from that. And then I have these two fingers are good. I'm going to keep my thumb away. I'm going to reach under this cuff and do the same thing with my left hand. I'm going to get my left hand in there. If I can. Get this over there. Now that I have sterile and sterile contact, I can fix my fingers to my glove. Unfortunately, this attempt didn't go so well. But as long as I maintain sterile to sterile contact, I'm in good shape and I'm allowed to do this. And once my right hand is somewhat situated, I can sort out this blob of a mess on my left hand. So get this figured out. Finally, sorry about that, bear with me there. I'm good to go. Now I need to prepare to clean the suture line. And in doing that, I'm going to take my sterile 4x4 pad and drop it in my saline solution. I'm going to carefully drop it, making sure not to touch any part of the side of the container. I'm going to do the same thing with the next one. And the next one. And the next one as well. And then on my last one, for the open wound, I'm going to put that to the side. And you want to let all of these kind of soak. And now that they are soaked in the saline, I'm going to only deal with them with my right hand to clean the suture line. I'm going to keep my left hand clean, and you'll see why in a second. I'm going to drip out all this saline solution to avoid contamination. Once I get all the saline out, I'm going to position it over my fingers. I'm going to wipe the least contaminated part of the suture line, which is the middle, in one swift motion from top to bottom. Once I do that, I'm going to find the trash can, and I'm going to drop it above waist level. I'm going to repeat the process, but now I'm going to stick to the right side of the wound. I'm going to drain all the excess saline out. Step number one. Now I'm going to clean the right side of the wound. One swift motion. Dropping that, keeping my hands above my waist. And on the last one, I'm going to wring out the saline solution, avoiding contamination and splashes. I'm going to position that over my finger and do the same thing to the left side. One swift motion. Now that I've done that, now it calls to dab over the suture line with my dry 4x4. And the reason why you want to do this is you don't want to leave any moisture on the suture line, because if there is, that's one of the primary causes of infection, moisture in a dark place. So we're going to take this sterile 4x4, we're going to position it similar to the ones we've been previously using, and we're going to lightly dab it all the way down from top to bottom to get rid of the moisture. And we're going to make sure we don't turn our back on our sterile field, and we're going to dispose of that, keeping our hand above our waist. Now that we are there, in this dry hand has no point anymore. It's time to fill the open wound with the 2 remaining saline 4x4s. So now that we're here, the only thing that we had to do earlier was just drain the saline out. It's very similar here, but you also make sure you want to fluff out to cover as much volume of the open wound as possible. So in the process of doing all of that, we do not want to drip. Just gonna take it, we're gonna drop it in. And we're gonna do the same thing with this one. Now normally, I would pack this wound to the top, but given that I only have 2 4x4s in this available solution, this is just a simulated practice. After fluffing it out, taking it and dropping it in. Now that I have stuffed that wound, there's only one thing left that I have to do. And I'm going to swiftly drop my ABD pad over the wound itself. And make sure there's no drops on my hand. I do not want to contaminate my sterile field. I'm going to grab my ABD pad. I'm going to grab it again, blue line up. I'm going to swiftly place it to avoid contamination. Now that my ABD pad is in place, my sterile work here is done. I'm going to take the glove off, starting with my non-dominant hand. This is a glove-to-glove interaction. I'm going to be over the trash can while I do this. I'm going to grab my cuff. I'm going to pull down and take this glove, keep it in my right hand. I'm going to take these 2 fingers, skin-to-skin contact, and do the same thing. And now that I'm here, the only thing left to do involving sterility is tape my ABD pad in place. So I'm going to grab my tape. I'm going to grab this tape and I'm going to approximate each and every side and tape it down like a window pane. So this is about right. Rip. Place that down. I'm going to discard this piece of tape because I messed up. And take this side down in place, making sure it's flat. I'm going to approximate the length of this one as well. This tape is all messed up, so I'm going to grab another roll. I'm going to drop that there. I only have one side left. I'm going to grab this roll. I apologize for that. I'm going to approximate the wound length. I'm going to make my final tape job. And after securing my ABD pad in place and making sure there are no bubbles in the tape and everything is taped down securely, you want to let the person who's coming behind you know who did it. And the only way to do that is to take a small piece of tape, a Sharpie, and write your initials, the date, and the time. Peel that off. Stick it on the outside of the wound, just like that. Now that my work here is pretty much done, I'm going to reposition the patient. I'm going to lower the bed, reposition this side rail. I'm going to finally perform hand hygiene dispose of my supplies, and I'm going to document the intact suture line and the open wound assessments while describing how the patient took both. Thank you.